Bismillah ar-Rahman ar-Rahim. Alhamdulillah, we have the presence of Dr. Ghorashi. In our session today, we are going to talk about ADHD and learn more about its symptoms. Make sure that we are not wrong labeling our children, and at the same time, we are not ignoring the symptoms that are there. The goal is to be able to help them to prosper in their endeavors in any capacity that it is possible for them. And inshallah, we are opening the way for them to actualize their potentials. Dr. Ghorashi is a psychiatrist. In his background, other than being a doctor in psychiatry, he has his PhD in cognitive psychology, and he was one of the teachers at like lecturers and professors at Harvard University in this field. I'm glad that he has accepted our invitation. Inshallah, the conversation will be very fruitful for all of the teachers and also the parents. Again, I would like to ask all of the teachers and parents not to mention the name of the child. The word will be a student if a child, in case they have a question. And if you want to use chat, you can simply write it down in the chat if you have any comments or questions, direct or in general. But still, I would love to ask all of you to mention if a student, not to mention the name or any specific quality of the child, that we will respect the privacy of the children as well. Dr. Ghorashi, please start.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Thank you very much for the introduction and for being here today. Today, as Sister Zainab said, we're going to have hopefully brief and focused talk about ADHD and hear more about what that is, what it looks like, what do we do with it, how do we diagnose it, what do we do about it for treatment and all that. So, but the first step obviously is to diagnose, to recognize it, to be able to identify or at least suspect if a child has ADHD. So I'm going to start by, let me, okay. So, I'll give it 1 second until I figure this out. Okay. So, as we all know, all of these, or many, I shouldn't say all, but many of the psychiatric disorders are actually based on very normal and common symptoms that all of us might experience in our day-to-day lives. You can give almost any psychiatric disorder, including anxiety, depression, even mania, even hallucinations. I mean, you can, I'm sure many of you have experienced, I don't know, at one point you felt that something moved in the corner of your eyes and it was like a shadow, and you looked back and there was nothing, or you thought you heard something in the background and you look back and there wasn't anything. Or I don't know, is there anybody who hasn't felt a little bit low in their mood for maybe a day or two after something happened? Or is there anybody who didn't feel anxious for a while something was happening in their lives, or there was a stressor? Or is there anybody who didn't feel very, very happy for, I don't know, a few hours or maybe a day after, again, something good happened to them, and they felt they were on the clouds, they were like so high. All of these are very natural and very common symptoms. So what happens when they become a psychiatric disorder? All of these become a psychiatric disorder when they either these symptoms either go much deeper than just what I explained, they become much more intense, or they linger for a longer time. It's not just being anxious for a couple of days because something happened, it just lingers for a much longer time. And for almost all psychiatric disorders, they have to impact one's functioning in a significant way. You can barely find any psychiatric disorder that doesn't have this in their criteria when they describe it in DSM. Almost all of them need to have a significant impact on one's functioning. So all of these together are what make a bunch of symptoms together to become a psychiatric disorder rather than a very normal experience after a disaster happens, a loss of a loved one, or a distressor in life. In psychiatry, we categorize disorders based on different things. So we put a bunch of these in a category, in a chapter of DSM. One of this is obviously similarity. They need to be similar disorders for us to put them in the same category. So that is exactly what makes it also more difficult to tease them apart, because they are very similar. Another characteristic is they might happen together more commonly than other ones. So that's another characteristic. And they also might have a very similar age group. So, for example, we put all of the children's disorders all in one category. We call them developmental disorders and so on, or geriatric disorders and so on. So that is how psychiatrists has come up with like how to put a bunch of these disorders together and put them in basically one chapter of the DSM. And as I already mentioned, one of these chapters is called neurodevelopmental disorders, or basically children's problems, because of that, those young human beings are still in that phase of their lives when their neural networks, their brains are still being developed. And it takes them, now they say, up to probably 25 years of their first part of years of their lives for the brain to kind of reach a state of more stable situation. So these are the disorders and conditions with onset in that phase of life, in the first, let's say, 25 years of our lives. And I know that it's not exactly childhood up to 25 years, but neurodevelopmentally speaking, up to 25 years is still an early phase for that development. Now, I'm going to give you some examples of what kind of things go in that chapter, what kind of disorders we talk about in that chapter. One of these is intellectual disabilities. I'm not going to go into details of any of these things. I'm just mentioning some names so that you're more familiar with what kind of disorders we're talking about in this chapter of neurodevelopmental disorders, or in this phase of life, basically for children. So intellectual disability is one of these disorders. It can influence their intellectual abilities or their adaptive functioning abilities. Another one is specific learning disorders, and there could be different types. It could impact their reading abilities, their spelling, their understanding meaning of what is read, written expression, or mathematics. Another example is communication disorders. And in this category, we have language disorders. Those kids have who have a problem with their language. Excuse me. Excuse me. Another one is speech sound disorder. They have trouble making some specific sounds, or they are stuttering, or they have this social communicating problem. These are all different kinds of communication disorders. Another example is motor disorders, and that can include things like problem with coordination, for example. These are clumsy children. They just hit different objects as they're walking or running. They're not very good in sports. They might drop things very easily and that kind of things. There is another one, stereotypic movement disorder and the tic disorders. Again, I'm not going into details of any of these things. I'm just introducing some, just throwing some names there so you're familiar with some of these neurodevelopmental disorders. Another one, obviously, is autism. I'm sure all of you are familiar with autism. Again, I'm not going into more details, but it consists of some kind of persistent deficit in social communication. They have deficit communicating with others. They're kind of in their own world. And another aspect of it is they have restricted, repetitive patterns of behavior or interests or activities. They might keep repeating the same pattern of movement even. They might like go back and forth all the time or keep collecting the same object all the time. Or they might play exact same game with the same set of toys all the time and that kind of things. And finally, we have ADHD, attention deficit hyperactivity disorder. So again, just keep in mind, the reason I'm mentioning all of this is just going back to that slide that we had previously. I'm just throwing these there for you to see how sometimes they are very similar and like they have very similar symptoms sometimes, which makes it more difficult for these to be teased apart and differentiated from each other. And a lot of these can actually co-occur, that they can happen together, they can exist together in the same child. That's another important thing. So that's basically why I'm mentioning some of the examples of this group, because now you know that, okay, maybe it's not ADHD, maybe it's something else, or maybe it's not just a learning disorder, maybe it's ADHD, or maybe it's both. So there is need for a right process of diagnosis and paying attention to all of these. Okay. Going back to that slide, so we are going to focus mostly on ADHD in this talk. What is ADHD? ADHD is a persistent pattern of inattention, as you can see from the name, a pattern of inattention and or hyperactivity and impulsivity that interferes with functioning or development. As I said, you can see that characteristic that has to be impacting and interfering with the function, with the normal functioning and development. As long as it's not impacting the normal functioning, that's fine. It's not a disorder. But when it starts interfering with their normal functioning, then that becomes a concern. So it should be investigated further. So as you can see, it usually has two different sides in it. It's ADHD. So it could be mostly inattention symptoms, or it could be mostly hyperactivity / impulsivity. And that's very important, because a lot of times what stands out to us is the second part, the hyperactivity. All of us have in mind, a kid that can't stay seated. They just climb the wall all the time. It's like they have a motor inside them. They're just running around, and they're very restless. And so that's the typical hyperactive kid. But that's not all that ADHD is about. Inattention is another part which could be much more silent and difficult to recognize. Some more general information about ADHD, the prevalence, they are mentioning anything between, I've seen stats, anything between like 3% to up to even 9 to 10%. A lot of sources say around 5% in children. Let's say 5, 6, 7% would be probably the norm. Which means basically that it's not a small number. It means that if you have a class of 20, chances are you have at least one child in there with ADHD. So that's considerable. The other thing is that there is the prevalence in adults is about 2.5%. It's half of what the prevalence is in children. But still 2.5% is not that low. So about half of these children kind of grow out of it, so to speak. And yet another half continue to experience the same symptoms in their adulthood. And that makes it even more important, because now I see a lot of adult patients on a daily basis who come to me realizing that throughout their whole lives they had these symptoms of ADHD, and I hear it a bit too often that I wish I was diagnosed a bit earlier so I could do something about it. Another thing about the prevalence is females are more likely to present with inattention, that first part of the ADHD, and therefore again that makes it more difficult for females to be diagnosed and identified by their parents or teachers. So that is also something to pay more attention to. So it is not exactly the typical hyperactive kid that you're looking at. It has other symptoms that you should be aware of. Some of the risk factors, for example, genetics plays a role. It is more prevalent in those families with a parent with ADHD or a child with ADHD. It's not 100% correlation, obviously. So if a parent has ADHD, it's not guaranteed that the child will have ADHD as well. Obviously not. But it makes it a bit more likely. So that's one factor, but there are other factors: physiological, environmental, temperamental, childhood traumas, either psychological traumas or even physical traumas, and all of that can play a role. Another important aspect of this that I want to emphasize is that sometimes I hear a lot that, okay, so what? My child has ADHD, so what? But it's not that simple. It has a lot of functional consequences. For example, it causes reduced performance. So a lot of these children with ADHD, they suffer and their performance suffer during school because they cannot just stay focused on things. They miss a lot of things. So the performance is reduced. Later on, it will be a higher rate of unemployment in ADHD patients. They will have higher interpersonal conflicts. I hear again a lot that they have problems with their spouses or even with their family members because of these symptoms. And when I tell you about the symptoms a bit further, you will realize yourself how it can impact those relationships. It can increase the risk of conduct disorder and antisocial personality disorder, meaning that both conduct disorder and antisocial disorder have a higher rate of occurring in those patients with ADHD. So that's another thing that makes it very important to pay attention to. The risk of substance use is higher in these patients. A lot of it is that because they are seeking something to help them focus. And as we know, a lot of substances, especially stimulants, can actually have a therapeutic effect on these patients. For example, cocaine can help with these kind of symptoms, but obviously cocaine is not the answer because it's very uncontrolled, and then it's addictive, and for that reason it's obviously not the solution. But that's one of the reasons these patients might seek those substance use. Another reason is that they're just impulsive, that they might impulsively do anything. The risk of injuries is higher in these patients, and even obesity is seen even more in the ADHD symptoms. So it's not that simple. It's not that, okay, he or she has ADHD, but it doesn't impact them much, so why should we care? Why should we care about it? These are all some of the reasons why we should care. There are comorbidities with ADHD. As I already said in a couple of slides previously, a lot of these disorders that happen all in childhood, they can happen together. They are more likely to happen together, some of which are these ones: learning disorders, autism spectrum disorders, tic disorders. These are some of the comorbidities that are seen more prevalent in patients who already have ADHD. But this is not only these ones. Sometimes, as I again mentioned, oppositional defiant disorder and conduct disorder can be seen more in these patients. These are patients who have, I don't know, at baseline, they are more angry, they are more irritable. They might have kind of, they're oppositional. They don't like obeying other authorities. Could be like the parents, the teachers that just don't like being told to what to do. And sometimes some of these patients with ODD, with oppositional defiant disorder, they might even enjoy disobeying them or enjoy annoying others. For conduct disorder, those are those children who might enjoy, who are kind of cruel to others, to other kids or to animals. They might destroy properties. They might shoplift sometimes and that kind of thing. So all of these are comorbidities in ADHD. Again, I just emphasize that it's not that all ADHD children are at risk of all of these, not at all. I'm just saying that these are some of the characteristics that sometimes are seen a little bit with a higher prevalence in children with ADHD. Mood disorders are seen more happening more frequently in ADHD symptoms, as well as the anxiety disorders. Even OCD, obsessive compulsive disorder, is more is a comorbidity with ADHD. And as again I mentioned already, substance use disorder is seen more frequently in ADHD patients. So again, just more reason to pay more attention to recognizing and diagnosing ADHD at an earlier time. So I'm going to show you a video clip. It's, I don't know, 7-8 minutes, that shows us what it looks like. So you can see it in the context. Again, I'm sure most of you are already familiar with this, but it gives you more like examples of what ADHD, both in attention and hyperactivity and impulsivity in the context, might look like. So let's have a look. You can hear the sound as well, right?
Yes.
Oh, sorry.
Oh man, I am so excited! Ooh, I wonder what everyone is doing. I love birthday parties. I love this movie. Especially at the end where they find out their neighbor is the bad guy.
Why would you tell us that?
Sweet! Pin the horn on the unicorn. There you go, Mr. Unicorn. One horn.
Hey, it wasn't your turn.
Dude, not cool. Cake? Cake is the best. Way better than pie.
What are you doing? That's for later. Vincent!
Oh man.
Vincent!
You guys have got to try this.
Vincent!
I think it has a raspberry filling.
Vincent!
What?
You've been here 2 minutes, and you've already ruined the movie, ruined the games, and ruined the cake.
You ruined my whole birthday.
I have this thing. It's called ADHD. I can't really explain it, but it sometimes makes me do things without really thinking. Guys, I'm sorry. I didn't mean to ruin the party.
Oh, yeah? Then why did you?
Yeah, it's not just today. You do stuff like this all the time.
I sure wish I had ADHD and could just do whatever I wanted.
It's not like that. It's actually really hard.
How hard can it be to just not do something? I don't do things all the time.
I don't know how to explain it to you guys. I'll just go.
Go? Why would you go when this party is just getting started?
Whoa!
The Medi Kids.
Oh, man. I cannot believe Chi is standing, floating, right in front of us. And there's Axon. Well, I don't know what he does, but I like his glasses and hair.
I'm a technology genius who also happens to have cool glasses and hair. Thanks for noticing.
I can't believe you guys came to my birthday.
Well, we're super excited it's your birthday, Jenny. That's not why we're here.
We have come to help Vincent and you understand ADHD. Please have a seat and let's begin.
Whoa. So ADHD is real?
ADHD is very real. It is a condition that makes it hard for kids to do things that might be easy for you, like paying attention, following rules, or sitting still.
Each letter in ADHD stands for a word.
A stands for attention. D stands for deficit. H stands for hyperactivity. D stands for disorder.
Some people with ADHD have trouble paying attention. This means they may have difficulty staying focused or finishing their homework. They might misplace their belongings, forget instructions, get easily distracted, or daydream during class.
So that's why you sometimes leave things in weird places. Why are these shoes in your fridge?
So that's where I put them. Ooh, they're going to feel so cool and refreshing.
People with ADHD can be hyperactive. This means they have too much energy and cannot sit still or take turns. Even teenagers who outgrow physical movement can feel restless inside. Kids with ADHD might talk all the time and have trouble keeping quiet at home or at school. I don't know what that's like. I mean, sure, I have lots of cool and fun things to talk about, and sometimes I might get carried away. Like this one time I was telling a story. Oh, it was a good story about...
Axon?
Yes?
Shh.
That explains why you have such a hard time at the movies.
This is a crazy movie. I'd run from a haunted house if I saw a ghost. Who saw my cell phone? I wish I'd bought popcorn.
People with ADHD can also be impulsive, which means they act without thinking first.
They may be impatient and have trouble doing things like waiting their turn.
That explains what happened with the pin the horn on the unicorn game.
Yeah, sorry about that.
Don't feel too bad. She wasn't anywhere close anyway.
They may also...
Interrupt people while talking? See what I did there?
Some children with ADHD only have trouble paying attention, but many have trouble paying attention and are hyperactive or impulsive too.
But I mean, all these things sound like stuff that happens to everybody. I love to talk, and I forget things all the time.
Jenny, are you still on the phone? Where did you put the dog?
Good questions, Mom. The answer is yes to the phone, and I don't remember where I put the dog.
Look, we can all be forgetful, distracted, impatient, or overly energetic at times, but this is different than having ADHD.
In ADHD, these behaviors are worse and happen more often. Also, they can cause problems at home, school, or when playing with friends.
Yeah, I'm telling you guys, having ADHD is not fun. Even though my parents and teachers are helping, and I am constantly trying my best, it doesn't stop me from getting into trouble. I feel like every other day I'm getting a lecture about things I have a hard time controlling.
Man, that does sound rough.
Yeah, I hate when my parents are mad at me.
It doesn't sound very fair to you either, especially if you can't control it.
One of the worst parts is I don't even know how I got ADHD in the first place.
Don't feel bad, Vincent. Even doctors and scientists aren't sure what causes ADHD. What we do know is that in people with ADHD, the brain works differently than it does in people without the condition. This makes it hard for people with ADHD to behave exactly the way other people do. The other thing we know for a fact is that living with ADHD is tough.
But isn't there anything doctors can do to help Vincent?
Yeah, isn't there a medicine or something?
Absolutely. Medicine is one type of treatment that can make it easier for someone with ADHD to pay attention, focus, and sit still or wait their turn. Medicine may also help kids with ADHD do better at school, get along better with friends, and feel more self-confident.
Along with medicine, there's also another kind of treatment called behavioral therapy that can help you control the way you act. With behavioral therapy, you learn strategies to deal with your ADHD, like learning how to stop and think before you act, or how to organize your stuff so you're less forgetful.
Yeah, my behavioral therapist is awesome. She gives me tons of cool tricks and tips, like putting up reminders and checklists for myself so I don't forget stuff.
Your family can help you deal with your ADHD too. Things like your parents giving you a schedule to remind you what you're supposed to do can really help. It also doesn't hurt if they give you a little reward for doing a good job.
My parents put alerts in my phone, so I keep on schedule and don't miss things. But I'm definitely gonna bring up the reward thing. I'll do almost anything for a prize. But here's the thing, guys. Even with medicine and therapy and trying really hard, I still have rough days. Days where I know I can be a lot, where I might seem annoying or like I'm not paying attention. But it's never on purpose. It's hard, and it sometimes makes me feel so sad and alone.
Dude, you're not alone.
Yeah, we're all here for you.
They're right. You are not alone. You have parents, teachers, friends, and a whole team of doctors and nurses ready to help you.
Yeah, and if the feelings ever do get too much, there are specialists you can talk to too.
You guys are awesome. I'm sorry I ruined your birthday, Jenny.
You didn't ruin anything. I'm sorry we overreacted.
As long as we're all together, we can still make this party awesome.
I think we can help. We Medi-Kids are good at 3 things. 1, educating. 2, medicine. And 3, partying. Behold, the
Okay. So I just wanted to show you some of those symptoms in the context. The address of the YouTube clip is here if anybody is interested. So what does it look like? As I said already, there are 2 parts in ADHD. One part is the hyperactivity and impulsivity, which stands out more readily to everyone. And some of those symptoms are things like feeling restless or on the go or driven by a motor. It's hard for these kids to sit still in class. They're just standing up, or they ask to leave to go to washroom or something. They're always asking to leave for some reason. They're just having a hard time sitting still, and they're fidgeting all the time. They're just moving around. They're going back and forth. They're playing with a pen and that kind of things. But there's also other things. They might talk too much, either in class or in any social situations. They just keep talking with others. They blurt out an answer before a question has been completed. They just can't wait. They interrupt others or intrude on others. Again, unable to play quietly. They're always shouting, probably unaware of what is happening around them. And again, waiting for their turn is very, very difficult for these. So as you can see, some of these are hyperactivity symptoms, some of them are impulsivity. And a kid needs to check at least 6 of these symptoms to say that he or she has hyperactivity or impulsivity. For the other side, for the inattention, what are some of those symptoms? Things like difficulty sustaining their focus. They're very easily distracted. They even avoid or dislike those tasks that require sustained mental effort and attention. So if there is something they're very interested in, it's like video games or, I don't know, computer games or, I don't know, cartoons and things like that, if they're interested in something, they might even hyper-focus on it for hours after hours. They might sit there for, I don't know, quite a few hours doing the same thing, gaming, for example, and not even notice what is going around them. At the same time, if you tell them to go and sit and finish their homework, they have a hard time to sit there even for 2 minutes. They might make a lot of careless mistakes, especially if they're doing a boring task, like finishing homework. They have difficulty finishing tasks. They might start a lot of things and just leave it unfinished after a few minutes and go start another thing and then totally forget about what they were doing. They start a project and then totally forget about it after half an hour, and then next day they start a new one. They're forgetful in their daily activities. You tell them something 10 times and they just keep forgetting it. It just doesn't register. They lose things or misplace things all the time. They misplace their belongings. They leave things at school that they needed to bring home, or they just keep losing their things. They are disorganized. you look at their desk or at their room, and it's a mess, a total mess. They just have a hard time keeping organized. And it's not just looking at their room, but even in their personal lives, like keeping a routine. Being able to stick to a routine is very difficult for them. You talk to them, and in the middle of your conversation, they're already zoned out in a different place, daydreaming. Or they're as a teacher, if you're just talking to them in the class, they're daydreaming in another world. So they zone out easily in either conversations or meeting, in classes, in lectures. So basically, what ADHD is about is it is about a deficit in their executive functioning. They know exactly what they're supposed to be doing, but they have difficulty doing it. So you as a parent or as a teacher might say, okay, I just told you 10 times to do this. And yes, they know exactly they need to do this. They know they need to finish this homework, and yet they keep doing other things until it's the very last minute, and then they sit on it and then finish it like quickly. They have like a deadline in 2 weeks. They don't do anything until the last night is there, and then they stay up overnight to finish it. They know what they should be doing, but they just have a hard time doing it. And that's the deficit in their executive functioning. So that's basically the gist of it. How do we diagnose ADHD? It's basically through professional assessment. So as a parent or as a teacher, you're familiar with the symptoms, so you suspect the symptoms in a child, and then you refer them to a professional, and then through professional assessments, which is done through interviews, questionnaires, or psychometric tests, they can do the assessment and come up with a diagnosis or rule it out. I'll show you an example of what a questionnaire might look like. So you might receive something like this as a parent or as a teacher. This is an example for parents' questionnaires. Something like this with a bunch of questions. It's not all about ADHD, but they're trying to cover and screen for a lot of other things as well that I already mentioned to you. And then you score them based on what your understanding and impression is of the child. If that statement applies to the kid, like not at all or very much, anything between 0 to 3, you score them that way, and then you send back the questionnaire to the clinician. This is the second page. And then there's a similar one for teachers. So you fill this out, you send it back to the clinician, they analyze it and put it together with other information that they collect. In this process, the report cards could be very, very important. So that's particularly important for teachers to write some of these in the report cards, because that's a very, very precious source of information for clinicians who are looking at this. And during this assessment, we always look at those comments you teachers make in those report cards. That gives us some clues about, okay, is this kid organized? Is he or she like paying attention during class? Are they daydreaming all the time? And that kind of things, when mentioned in those comments in the report cards, they are very valuable. And then as for the treatment, there is school accommodations, obviously. So for those patients with ADHD, there are accommodations that a teacher or school can come up with, and then together with the clinician, that they can come up with a plan how to accommodate these children and students. There are behavioral treatments, and there's medication as well. Does everybody need medication? It depends, probably on the severity of the symptoms and what parents want to do, but medications are usually helpful, usually well tolerated. Obviously, nothing, there's no medication in medicine with no side effect. There are some side effects as well, but it's always a matter of measuring the benefits versus the risk and see if it's worth it or not. So you always have that conversation with your clinician, and then you come up with a plan as what to do, and then you do the treatment, whatever that is that you like it to be. So I think that is it for my part of the talk. I think we still have about more than 10 minutes for questions. Thank you very much for listening, and I will be happy to answer those questions if I can.
Thank you, Dr. Ghorashi. There are some questions in the chat, if you don't mind answering them.
Okay, first of all, if there's anybody who wants to read their own, I mean, that they want to say it out loud, that would be great. So I'll wait a second if there's anybody who is who would like to ask the question before I proceed with reading it myself. Sure.
Assalamu alaikum.
Alaikum salam.
Thank you so much for the presentation, brother. So I have a question in regards to where a student is not displaying the hyperactive side. However, we can feel in class that they may be completely inattentive. The child may be social. They may not have problems with interacting with other children. However, a lot of the times the child has a problem to focus on what is going on in the classroom, based on two things: based on the teacher's instruction, and also an absence of observation of what is happening around the students. So many times there will be students that may miss the instruction that the teacher gave because their thoughts were somewhere else, but they may observe what is happening in class and they may catch up. So if there is an absence of these two things, other than that, there's no other symptoms in terms of hyperactivity or any social problems, then would that be a red flag for the teacher?
So, as I said, it could be predominantly inattentive. Maybe there's not much of the hyperactivity or impulsivity in the picture, and it could be mostly predominantly inattentive. So if you see enough of those inattentive symptoms that I list, that I put on the list there, then yes, it's a good reason. So if the student is not paying attention most of the time, if they are daydreaming all the time, if they're missing some details in their homework, if they're making a lot of careless mistakes, that kind of things, if they always procrastinate on finishing assignments, if they are usually disorganized. So if they have enough of those symptoms, if you think they have at least 5, 6 of those, then yes, there's definitely a reason to suspect ADHD inattentive.
Thank you. And would that lead to, for example, a manifestation in terms of them comprehending when they're reading texts as well? Because their mind is wandering so much, they are not able to understand what they're reading.
So that makes me think more of a learning disorder in kind of maybe there's a learning disorder in a specific learning disorder in reading or comprehending the context or that kind of thing. So that's always a differential diagnosis that you should also pay attention to and be aware of and be concerned about. So is it just because of ADHD that this happens? Yeah, it could be. I mean, if somebody is not paying enough attention, they have a hard time reading for sure. But is it the only reason, or is there a reading disorder, learning disorder in reading as well? I mean, it's hard to tell unless there is an assessment.
All right, thank you.
Assalamu alaikum, doctor. I'm the one who posted the question about a minimum number of symptoms to check for in the attention deficit part. So thank you. I think your comments just now just answered that as well. So we're looking at what, 5 to 6 as well on the attention deficit as well?
Yep.
Okay, thank you so much.
Assalamu alaikum. There's another question about the gender differences. Can we see the symptom among girls different than among boys? Like, for example, sometimes this schema that, for example, boys are more impulsive and more hyperactive, and girls are more inattentive. Is it true, or it can be totally different?
So I think I already mentioned in the presentation that more frequently girls present with more inattentive presentation than hyperactive, but you should be careful about that. It's just a matter of proportion. It's not that we do not see hyperactive or impulsive girls. We do see that all the time. It's just a bigger proportion of girls presenting with inattention than hyperactive. So can you see hyperactive and impulsive in girls? Absolutely, for sure. Can you see inattention in boys? Absolutely, all the time. But it's just a little bit more prevalent. The inattention is a bit more prevalent in girls than boys. But you can see all of them in both genders all the time.
Thank you. And for those parents who are thinking that, okay, maybe my child is not diagnosed with ADHD because he doesn't have 6 categories of hyperactivity or same thing in attention deficit, but still I see that how it is hard for my child to maintain his or her focus or to follow the instructions when this is a social setting. So what do you suggest for them?
So if you absolutely do not suspect this and you think that is not a question, then there are other things that might be there. Maybe, I don't know, if for example, let me give you an example. If a student is gifted and they are in the 99th percentile in mathematics, then almost any mathematics class would be very boring for them, so they wouldn't be paying attention. But at the same time, they're also doing very well in any exams or things like that. So there are lots and lots of other factors that should be factored in when you consider a problem like that. But if you suspect any of this, I mean, if you doubt if this is ADHD or is the learning disorder or anything else, the best way of dealing with it is to refer to a professional assessment because of all of those consequences that I mentioned in the presentation. Because if there is something and you don't deal with it early on, then there are consequences that could have been prevented if it was dealt with.
Thank you. There's another question that sometimes the medication for ADHD may prevent the growth of the child, like physically. It affects their height and it delays their physical growth. So is the myth or this is the side effect of those medication, and then later on there's another treatment to redress it?
Very good question. So It is actually now a controversial thing because some studies show some effect of these medications on the growth and height. But even those studies that show that the average impact on the height is about an inch. So it's not like several inches or anything like that. So about an inch of difference. And then there are other studies who do not show that impact. So they say that, I mean, they run thousands of patients and in their studies, and they couldn't see that same impact. So it is controversial. We're not sure about it, but there are some studies that show it. But even those studies are not that like that dramatic of an effect. So again, it is a matter of weighing the two sides of the benefits and the risks, and it all depends individually on each patient. So it's hard to come up with an answer for that would suit every student and child. It depends on the severity of the symptoms. It depends on the consequences. It depends how much the symptoms are impacting their performance, for example. Is it worth, even if the impact is like an inch of shorter height as an adult, is it worth like the impact that it has on the performance in their career, in their success, in their relationships and things like that? It all depends on the severity of the symptoms. So it's an individual decision.
Thank you. Sister Fatima, you're raising your hand. Do you have a question? Please go ahead.
Yes, salam alaikum.
Alaikum.
I have a question. As far as I understand, the chance of seeing ADHD around our children is something around 5%, yes?
Yeah, let's say that's, yeah.
So, but as a teacher, I can see those symptoms at least 6 out of 10. I have a 5, let's say 5 student, 2 out of them, I can see those symptoms around them. So my question is, if their performance in the subject is not below the average, meaning that, for example, I'm teaching math and their performance in math is B+ or even A-, can I say that they have ADHD because I can see those symptoms, or no? As far as their performance is over the average, so we ignore that.
So 2 things I would say to answer that very good question. Number 1, stats could be very tricky sometimes. So when we say that about 5%, it doesn't necessarily mean that if you have a school of 10 classes of 20 students each, you must have 1 student in every single class. It doesn't work like that, as you know. So don't let the stats trick you that way, because it could also, I mean, stats, it's probabilities, right? So yeah, you might have a class of 10 or 5 students, and you might end up having 2 of them in your class. It's possible, it's not impossible. So if you see obvious symptoms, you shouldn't, I mean, you shouldn't be tricked by that, by saying that, oh, no, it's impossible because it should be 5%. So I'm definitely wrong. No, I mean, we're talking about probabilities. So it is possible. So that's one thing. The other thing is that, as I said, it's a constellation of symptoms we look at. You shouldn't just base your diagnosis or your suspicion on only one symptom or a couple of symptoms. So if you see a bunch of these symptoms that I already mentioned in a student, then another thing is that you also mentioned a very good point in like how much it's impacting them. So the impact on, so you are a mathematics teacher, and so you see only the impact on that performance. It could be that the student has ADHD, but he's also, or she is also a genius in mathematics, and it doesn't impact their performance in mathematics. That's one possibility. Or maybe they're just particularly interested in math, and this is some of those things that they like doing, and it doesn't impact their performance in that subject. That's another possibility. Or maybe their parents are just forcing them and like scaffolding them in their at home so much that they're sort of like on top of everything at home, and they're forcing them to finish the homework and everything on time, and for that reason they're doing all right. Or it could be it's just not ADHD. So all of those are possibilities. So you need to look at the whole picture and see the performance in other areas, like how they're doing in other areas, and all of that. So it's just by looking at the whole picture that you can tell.
Thank you very much. So by just seeing those symptoms, we cannot label a student as an ADHD. We have to see the other aspect, like performance. Yes, am I got it or not? Or no?
Yes. So the short answer is yes. I just don't like the word, the labeling. I mean, we're not labeling anybody with anything. We're just trying to help students, because everything that I just said in my presentation is just a matter of trying to help them. Because if a student has ADHD, and if you recognize that early on, that there are things that can be done and to help them. And that's all we are trying to do. We're not, it is not a matter of labeling.
Thanks.
Sister Fatima Ali?
I have a question.
Yes, thank you. Oh, sorry.
Go ahead, Ms. Fatima.
Sorry about that. My question was, say I do feel that there's a student presenting multiple aspects of the inattention in my class. As a teacher, are there any specific strategies that you feel like work, or that I can use in my classroom to help, or that are particularly successful in helping in such cases? Or is it case to case more?
I mean, there are case-to-case things, and there are more general level things. First of all, I would recommend that you definitely try to send that student for proper clinical assessment, because in that assessment, it might be ruled out, it might be ruled in, and then if it's ruled out, then you don't need to worry about it. If it's ruled in, and then there's a lot of other things that can be done for them. So that would be number one recommendation. But in general, at a more general level, for these ADHD students, it's sometimes helpful because a lot of times kids with ADHD, they actually can stay focused if they're fidgeting. That's why those fidgeting toys are there. So if they're fidgeting with their hands, if they're doing something, sometimes teacher might say, "Oh, don't do that. You're distracting yourself or others." But actually, that's what is helping them stay focused on what the teacher is saying. So letting them fidget, if that helps them. I'm not saying that you should let them just daydream all the time if they want to, no.
Yes.
But if there is something that they think it helps them, if they, for example, if they stand up and that way they can listen better, then let them stand up. If there is a toy that they can fidget with and that helps them listen better, then let them do that. You can put them in the back row so that they don't distract others, or you can arrange things so that they don't start talking to everybody else. But if there are these kind of strategies and techniques and tricks that you can use, whatever they think is helping them, then yeah, you can do that to help them. Sometimes they need to, I don't know, to just go around and come back for 5 seconds. That helps them just to refresh and be able to listen to the rest of the class. Let them do that.
Sorry, just to build on, and what if the problem is more so completing tasks? They're listening, they're attentive, but when the task starts, there's just, perhaps it's boring, perhaps, you know, other things, but there's just inability constantly to complete tasks.
Like what kind of task?
More so writing.
Yeah, that's a bit more tricky. I really don't have enough of the tricks, because that part I don't deal with usually in my day-to-day life. We have like coaches who do that, so I'm not too familiar with that kind of tricks. So I would refer you to that kind of professional.
Thank you so much. Sure. Thank you.
Dr. Talai, then Ms. Sarah, and then Ms. Farva.
Assalamu alaikum.
Alaikum salam.
Thank you for the informative presentation, Dr. Ghorashi. My question is a bit more general than the children with ADHD, because of the use of technology and the excessive use of digital technology nowadays by children, even at elementary level. So I would like to see whether you've got any suggestions for the attention problem in general, not as a disorder, but the problem for the common students who are coming to the class, but their attention span is so limited. Even this happens for adults nowadays, but this is a lot more common for the children because they spend more time with digital technologies. And we have a problem teaching them the school subjects because of this attention problem, if we can call it.
Yes, you hear that a lot these days, and I wouldn't be surprised if that is a part of the problem. The thing is that there are not enough studies done yet to confirm that. It's a matter of controversy at this point. There are some studies that show some effect of those, and there are some studies that couldn't show the effect. So it depends on which aspect and which angle you look at. So, I mean, theoretically speaking, I mean, yes, for sure. I mean, it's not too difficult to imagine that if you're all the time on TikTok and you look at pleasurable, I don't know, clips or things like that every 5 seconds or 10 seconds or a minute, and that's how much you can sustain your attention, and that's what you're used to, and then I wouldn't be surprised if that could be a part of a problem. Again, does it cause some like ADHD, or does it change the taste of the student? That's the problem. So there are not enough studies to scientifically show that actually there's a causal correlation between those two, but could it be a factor? I wouldn't be surprised to imagine that.
Thank you.
Thank you. Ms. Sarah?
Okay. Thank you.
Sorry. Can I go?
Can I go? You can go. You can go.
Okay. Hello, everyone. Thank you, Dr. Ghorashi, for your comprehensive presentation. Maybe my question has some overlap with Dr. Talai's question. Regarding daydreaming as a sign of ADHD that you mentioned in your presentation, I just want to know, because of the use of screen, because kids have a lot of screen time these days. So how we can differentiate that, for example, if a kid is talking about, for example, Minecraft, zombies, or something like that in the class, is it a Is it a daydreaming, or is it because of the exposing too much to screen time? Is there any clue that we can understand that, okay, it's a sign of ADHD, or no, this kid has to work on screen time at home?
Very good question again. And yeah, that, all of that, I agree that it could be very challenging to tease them apart. Again, I would invite you to pay attention to the bigger picture rather than focusing only on one symptom or one aspect of it. So it takes more than one symptom to come up with an ADHD diagnosis. So yes, that daydreaming is one part of it for sure, but it also should include other symptoms. So if you're not sure if this is daydreaming or not, which I agree with you, it's hard to tease apart. So now I would invite you to pay attention to other symptoms that are less correlated with that aspect of that symptom and might be more helpful.
Thank you very much. Thank you.
Thank you. Ms. Farba?
Okay, thank you. Thank you, finally.
Sorry,
Okay.
because I don't see your hand up. I see in the list, and
Yeah,
whoever has
it's the phone problem. It's a phone glitch. Okay, so my question is that a lot of symptoms that a child shows when he or she has an ADHD affects their personal life, their personal growth, their academic growth, all of that. And the family is dealing with that. The child, him or herself, is dealing with that. But there are a lot of symptoms of ADHD, as far as I can tell from your conversation, that affects the social life of the child as well. Now, we as teachers or as parents, how can we socially regulate their surroundings, or what tools can we equip them with, or what are the things that we can take care of as instructors or as parents that that can make the environment socially suitable for them? Because again, the growth of a child, as we talk in Selm, holistically, is not only physical or mental. It has to be socially, the child has to be socially well as well. So what can we do to help a child who possibly has ADHD make fruitful social connections that support their treatment and their well-being, as well as keep everyone around them safe?
Again, very good question. Thank you. I would encourage all parents of the students who are already diagnosed with ADHD, as I mentioned, in my presentation and during that video clip that I showed you. The treatment of ADHD is like multi-levels. One is medication, but a good part of it is behavioral. And in those behavioral coaching or therapies, a lot of these aspects of their lives are discussed. So the kid learns how to behave in the social context so that they are not presenting those problems, are not causing any conflicts and things like that. So one aspect, maybe the most important aspect of it is for the kid to learn these things, because it doesn't matter how much you as a teacher help them in that specific class that you're in, or the environment helps them, as soon as they leave that context, that environment, they still have that problem. So they should not depend only on the kind of help you give them and the structure you build around for them. It should come from their within, and they should learn how to deal with it, so that the context shouldn't matter. So that would be the most important part. So I would invite all parents to consider that, because it would be a skill that they learn, and then they can use it in any context. So that would be my first step. But then, yes, there are things that as a teacher you can do. We already talked about some of those. but to help the patient, the kid to flourish in basically in that context, not allow others to like make fun of them or to like make it a welcoming environment for all kind of neurodivergence to flourish in. That's for sure something that teachers can do, but the main part should come from within so that they learn the skills how to deal with this so that the context shouldn't matter.
Okay, so just one add-on question. Do kids with ADHD, can they thrive in a classroom similar to other kids, or they do require differentiated instructors and learning instructors as well? I mean, teachers, if they want to cure, they want to come out of it completely. So can they survive parallel in a classroom with normal kids, or is it better to put them differently?
I mean, in this society, I would say almost all of them, most of them are in the same classes and they don't go in a different class. So yes, it definitely is possible for them to thrive in the same class.
Okay, thank you.
Again, there's a lot of accommodations and things like that that will come into place, but it's possible to do that.
Thank you. There's another question regarding the eye contact. One of the teachers actually asked that among all the symptoms that you mentioned, not making constantly eye contact can be a symptom.
So it depends. Does it mean that when you're talking to them, they're just daydreaming in a different world, and that's the reason why they're not making eye contact? But when they are paying attention and when they are interested, or if the conversation is short and doesn't take long, they make good eye contact and very normal eye contact. If that is the case, then that's not a problem. But if even in the short conversations, even if they're interested, even if they are not very distracted, even if that is a problem and they're having a problem making proper eye contact, then you might think of other things like autism and things like that.
Okay, thank you. Ms. Leila, do you want to make any comment on that, or the general answer was enough?
Assalamu alaikum. Thank you so much, Dr. Ghorashi, for your helpful presentation. Yeah, it was my question. Actually, this symptom is in very short conversation, and when I directly talk to the students, and it's happened all the time. Whenever I'm talking to that specific students, and even whenever he or she comes to me and asks me something, or he or she wants to show me his or her works, he doesn't make any eye contact with me. This is the thing, and it's very visible in my class. It's not just among one. I can see more frequently, not among just one. That's why I'm concerned about that. Yeah, and in some of them, those symptoms that you mentioned about not paying attention, very hyperactive, it's very visible. But in two of them, no, just not making eye contact. Thank you.
Thank you again. So again, in a lot of these psychiatric disorder, what is important to notice is a pattern of the constellation of symptoms together. So this is a clue that you're noticing not making eye contact. So now you need to figure out other clues. So does it take you more to the realm of ADHD and those kind of symptoms? Does it take you more to the realm of autism and not communicating well with others? Does this student have enough friends? Is it difficult for them to make friends? Are they having problem communicating and expressing their feelings or noticing other people's feelings and that kind of things? Are there any repetitive patterns of motion or interest and that? So those there are the other things that start to differentiate the two things from each other. Keep in mind that they all can live together as well. So there are lots of students who might have both autism and ADHD. So that's another difficulty. So or is there none of this? Is it a cultural thing? In a lot of cultures, as you know, you don't stare at the other people, at the other person. When you're talking to them, you might look around instead of looking at them. So is it a cultural thing? Is it just because the student is shy and it's nothing else? So those are the other things that come into play and play a role in differentiating all of this. So it is important to also notice those other symptoms that might be there to start to differentiate these things.
Thank you so much. Thank you.
Thank you. I wanted to ask and add on that we can consider the social anxiety tic at the same time with ADHD. If there are lots of blinking and lack of eye contact, it can be a combination of tic and ADHD. And also, again, if the anxiety goes up, like in the assessment situation, or when you are actually penalizing the child for the wrong action they have done, if blinking goes up and then lack of eye contacts goes up, maybe more than considering that as a communication problem, it's more as a presentation of anxiety. Is that right?
Absolutely, yeah. The good thing about Selm Academy is that you all have an expert there, Sister Zainab, who can help you in all of those.
Oh, thank you so much. There was the last question is does age maybe play a factor in something like eye contact? The question of one of the teachers. Actually, the question, if I can add to that, is that you may feel that this child is super hyperactive and impulsive in kindergarten, but as the maturity comes, you may see less of those symptoms and a different presentation. For example, when the child is 10 or 11 years old. Um, in that regard, actually, this is another question of some of the teachers.
Sorry, can you say it again, or can you elaborate a bit more what the question is?
So the symptoms are not constant. If the child is super impulsive and hyperactive, for example, at the age of 5 or 6, this child can be more inattentive.
Oh, I see.
At the age of 12.
Okay.
As the growth is coming, the presentation of the symptoms are different.
Absolutely. So, and that's exactly what they call it, different presentations, not different types. The ADHD doesn't have different types, it has different presentations. So one presentation is predominantly inattentive, one presentation is predominantly hyperactive or impulsive. And the third presentation is a combined presentation, which is obviously the combination of both. So they call it presentations, not types, because it's not that if a kid is inattentive as a kid, then that's their type and that's going to, what is going to stick to them. No, these are presentations and they can change all the time. So yes, it's absolutely possible that a kid is hyperactive or combined as a child, and then later on they become inattentive or vice versa, or they change again. Yeah.
Thank you so much, Dr. Ghorashi. Thank you so much to all of the teachers who attended and all of the parents who attended today. Inshallah, we'll try to have more of the professional development sessions for the teachers and also training sessions for our parents, inshallah, with Dr. Ghorashi and other experts in the field from the community and out of the community, just to serve the students at Selm, inshallah, and the broader community is our intention. Thank you so much again. God bless you. Take a good care of yourself, everybody, for the office.
Thank you.
Thank you so much.
Thank you. Khudafez.
Thank you.
Thank you. Khuda Hafiz.
Thank you so much.
Thank you. Khuda Hafiz.